हेलो फ्रेंड्स, वेलकम टू माय चैनल एएमएस एजुकेशन। आज का हमारा टॉपिक है अबॉर्शन। सो व्हाट इज अबॉर्शन? अबॉर्शन इज अ मेडिकल टर्म फॉर द डिसरप्शन ऑफ प्रेगनेंसी बिफोर द fetus reaches its viable age of more than 20 to 24 weeks of gestation or weighs at least 500 grams. So this is abortion. It is a medical term for the disruption of pregnancy before the fetus reaches its viable age of more than 20 to 24 weeks of gestation or weigh at least 500 grams. Pathophysiology. The most common cause of abortion is abnormal fetal development, which is either due to chromosomal aberration or teratogenic factors. So जो common cause होता है वो होता है fetal developmental abnormality, which is जो किसके कारण हो सकता है? Chromosomal aberration and teratogenic factors. Another common cause is the abnormal implantation of the zygote, where there is inadequate endometrial formation or the zygote was implanted on an inappropriate site. So another cause है क्या? Abnormal implantation of zygote, where there is inadequate endometrial formation or the zygote was implanted on an inappropriate site. This would cause inadequate development of placental circulation, leading to poor nutrition of the fetus and eventually to an abortion. So this was a pathophysiology. Now we'll see what are the risk factors for abortion. Congenital structural defect, low progesterone, RH incompatibility, undernutrition, drugs, infection. तो पहले हम देखेंगे congenital structural defect. This may be due to chromosomal aberration or a serious physical defect. Low progesterone maintains the deciduous bacillus. If the corpus luteum fails to produce enough progesterone, it would risk the life of fetus inside the uterus. RH incompatibility, the fetus could get rejected from mother's body if they have incompatible RH. So the fetus can rejected from mother's body if they have incompatible RH. Undernutrition, lack of nutrients would cause undernourishment to both mother and the fetus, leading to abortion. Drugs. There are drugs which are contraindicated for pregnant women. So ingestion might compromise the fetus and lead to abortion. Infection, the fetus would fail to grow and estrogen and progesterone production would fall. This will lead to endometrial sloughing, then prostaglandin would be released, leading to uterine contraction and cervical dilation, along with expulsion of the products of pregnancy. These are the risk factors of abortion. Next, we will see what are the types of abortion. Threatened abortion, inevitable, complete, incomplete, missed, and recurrent. So we'll see what is the first point. First abortion type, threatened. The embryo is already viable. The product of the conception is still intact and the cervix is closed, but there is vaginal bleeding present. So this is threatened abortion, meaning the embryo is already viable, product of conception are still intact and the cervix is closed, but there is vaginal bleeding present. Inevitable, the embryo is dead with the products of conception either intact or expelled. The cervix is already dilated and there is presence of vaginal bleeding. So this is inevitable abortion. Complete, all the products of conception are expelled and the embryo is dead, the cervix is dilated and there is mild bleeding. This is complete abortion. Incomplete में क्या होगा? The embryo is dead but some products of conception are still intact. The cervix is already dilated and there is severe vaginal bleeding. This is called incomplete abortion. Missed abortion. The embryo is already dead while inside the uterus. The products of conception are still intact and the cervix is closed. There are brown vaginal discharges present. This is called missed abortion. And what about recurrent abortion? Abortion becomes recurrent once the woman has 3 consequent miscarriages at the same gestational age. It is called as recurrent abortion. So this was about the types of abortion. Signs and symptoms: vaginal spotting, vaginal bleeding, cramping, pain, sharp, dull pain in the symphysis pubis, uterine contraction felt by the mother. So vaginal spotting appears as a small brownish to reddish spots of blood coming out of the woman's vaginal opening. This usually occurs when the cervix slightly dilates because the woman may have tried to lift heavy objects or mild trauma to the abdomen occurred. Vaginal bleeding is a serious occurrence during pregnancy because it might indicate that the cervix has opened and products of conception might be expelled. Cramping pain, this could occur on both sides and could be caused by trauma or premature contractions that might cause cervical dilation. Uterine contraction can be false or true, but either of the two could be alarming during the early stages of pregnancy because it could expel the contents of uterus, thereby leading to abortion. So these were the signs and symptoms. Diagnostic test, pregnancy test to confirm the pregnancy. First, if vaginal bleeding occurs, if test turns out negative, then the woman would have been subjected to other diagnostic tests that would confirm the nature and cause of vaginal bleeding. If it is positive, then abortion would be considered and it would be classified according to the presenting signs and symptoms. USG, ultrasound, the safest and confirmatory test for pregnancy. The ultrasound would be able to confirm if the pregnancy is positive and also confirm if the products of conception are still intact. Medical management. So how do you manage medically? Administration of IV fluids such as lactate, Pringles lactate, IV therapy should be anticipated by the nurse as well as administration of oxygen regulated at 6 to 10 little per minute by a face mask to replace IV fluid loss and provide adequate fetal oxygenation. Avoid vaginal examination. The physician would also avoid further vaginal examination to avoid disturbing the products of conception or triggering cervical dilatation. The physician might also order an USG examination for more information about the fetal and also maternal well-being. Surgical dilatation and evacuation, dilatation and curettage. Dilatation and evacuation, this is to make sure that all the products of conception would be removed from the uterus. However, before undergoing this intervention, the physician must be sure that no fetal heart sound could be heard anymore and the ultrasound must show an empty uterus. Dilatation and curettage, this is most commonly performed for incomplete abortions to remove the remainder of the products of conception from the uterus. Since the uterus would not be able to contract effectively, the contents might be trapped inside and could cause serious bleeding and infection. So this is the dilatation and evacuation, dilatation and curettage. Nursing assessment. The presenting symptoms of an abortion is always vaginal spotting, and once this is noticed by the pregnant woman, she should immediately notify her healthcare provider. As nurses, we are always the first to receive the initial information, so we should be aware of guidelines assessing bleeding during pregnancy, ask the pregnant woman's action before the spotting of bleeding occurred, and identify the measures she did when she first noticed the bleeding. Inquire of the duration and intensity of the bleeding or pain felt. Lastly, identify the client's blood type for cases of RH incompatibility. Nursing diagnosis can be risk for deficient fluid volume related to bleeding during pregnancy. So intervention will be, if bleeding is profuse, place the woman flat in bed on her side and monitor uterine contraction and fetal heart rate through an external monitor. Also measure intake and output to establish renal function and assess the woman's vital signs to establish maternal response to blood loss. Measure the maternal blood loss by saving and weighing the used pads. Save any tissue found in the pads because this might be part of the products of conception. Evaluation. The aim for evaluation is inclined toward restoring the maternal blood volume and stopping the source of bleeding. Client's BP must be maintained above 100 by 60 mm of Hg. The pulse rate should be below 100 beats per minute and the fetal heart rate must be at normal level of 120 to 160 beats per minute. The client's uterine output should be more than 30 ml per hour and only minimal bleeding should be apparent for not more than 24 hours. So this was about topic abortion. I hope you like the topic. If yes, then kindly give your feedback in the comment section and please like, share and subscribe. Thank you.